Okay, good afternoon, everybody. My name is Vi. I'm a nurse and also a midwife. Currently, I'm acting chief matron here in Ron Hospital. And my colleague here beside me, she's Cheris Tupuria. She's also a nurse and a midwife. Currently, she is in training unit and she is the trainer. This afternoon, we're going to listen to our experience. We're going to share to all of you about bomb threats in Nauru and the emergency response. Wow. Okay. Just an introduction of the presentation, a little bit of history of Nauru, identification of the bomb, and preparation in Ron Hospital, and the reflections what we did, and with the means training. That's the map of Nauru. Nauru is also known as the Pleasant Island. It's an island country and microstate in the Micronesia. It's part of Oceania in the Central Pacific. Nauru is 21 square kilometers, oval shape in the southern western Pacific, 42 kilometers south of the equator. Estimated population is 13 to 15,000. Nauru is just one island. There's no small islets like other Pacific island, and it's 45 minutes when you go around the island by car. So it's just quite a small place. Okay, when and where we found this bomb on the 7th of July, 2023. That's a few months ago. A large World War II UXO bomb, 227 kg, was found in Iwo district. The unexploded bomb was discovered by workers doing the construction work for the wharf that is being built. So when you look at the map, it's the red mark there. That's where the bomb was found. So what is at Iwo district? This is where all the very important facilities to the island. The Nauru airport, the wharf, where the boats are coming in with cargoes, water desalination plant, and with reservoir tanks, the power station, the schools can deliver for the phosphate and also the fuel for pipelines and some housings around that area. All are located in the red zone within that cordon off as the blast area. So we were facing not only effects of the casualties from the blast itself, but threats from having all of these vital areas, services being affected aftermath. Example, if there's no water, no airport access, people will be being displaced. Could you press again? Okay. So this is the bomb site. You can see the red zone around. That is the red zone. So from the 7th of July until the 20th of July, that's when the bomb will be disarmed from that site was seen. So this red zone, that's the day on the 20th Thursday, everyone living in that area will be evacuated. Okay? So all those important facilities for the island are all in that red zone. Eh? That's the wharf where the boats will come in for cargo, and that's the cantilever where the phosphates and the fuel pipeline for the island for Nauru, and that's where the power station is, and the water desalination, and beside that's where the heart is, and that's the hospital, and beside the hospital that is the school, one of the college, and that's where the airport. So within this red zone, all these important facilities are all in this red zone. Eh? So it's a very it's very it's a disaster for Nauru if this bomb exploded where it was found. Eh? So we thank the Australian for sending their teams to help us with the planning of disarming of the bomb away from these important facilities to a place that will need to be detonated. Eh? So this is happening when that day when it was the bomb will be disarming, all the road will be closed because people will be evacuated away from that red zone. Only the police are moving around on the red zone. Just a few shots from where the bomb site was found. This is what the ADF team did. Eh? So these big sandbags. Eh? They filled with sand, so they can place it around where the bomb is. Eh? Remember that the bomb was found on the 7th of July, but it was disarmed on the 20th. Eh? Within that 13 days, they were planned properly how they're going to transfer that bomb to the top side where they will detonate that bomb. Eh? So this is what the ADF did. They dig around everywhere so they can put all those sandbags so they just to be safe in case it will blast when people moving around. So they place all those sandbags beside the bomb, eh? While waiting for the plan to be confirmed and the day, so they will be transferred that bomb to top side.
The ADF we were referring to is the Australian Defence Force team, and they were called to help with this situation on the same day when they discovered the unexploded bomb on the island. So they flew in with the team, the Australian Defence Force team. Yeah.
So that's the bomb in the middle. So you can see all those walls there. Those are sandbags, eh? But they are very huge ones. So what they did, they just put around it just in case to be safe. Because in case it's exploded in eye wall, it won't be blast to the sides. Eh? It just goes straight up. Okay? So that's their plan why they did all those sandbags. They piling up to high levels, so if it's exploded, it just goes straight up in the air. It won't affect, like, go to the sides.
And this bomb, when you can see it here, it looks quite cute, but in actual fact, it's the size of a truck. When you go next to it, it's quite big and it's heavy as well, 227 kilos. So on the right of the screen, you can see a public notice that was sent out to the public, informing everyone that for the 20th of July, the bomb will be disarmed. And before that, there was some debate, as in transporting it and then detonating it in a safe area, or will they attempt to disarm it on the same place that they have found it and reduce the risk with making technical mistakes with moving the bomb to a different area. So in this section, they evacuated people living within 2 kilometers of the red zone area, and some sport complex and other church and other areas were mapped out as the main points. Like if you are within these main points here, you have to evacuate, because no one knows how far they are from the red zone. Like you don't see a red zone, but they'll just tell you, if you are behind this shop, you evacuate and things like that. So for the Australian Defence Force, the Naurus Police Force, and the fire department, they worked in collaboration, and they were tasked to lead the evacuation of the people and provide a hotline for information and everything else. At the bottom here, a little note was sent out to the public in terms of how they can protect their houses. We were all encouraged to open the windows of your homes and your cars, because there will be more injury to the people if the blast came and windows were shattering into your homes. And then you have to cover your windows with blankets or bed sheets, secure your valuables, because we know that even though people were being evacuated, there is the also the risk of some some opportunists going around and raiding homes that are being evacuated. So yes, so you have to take your valuables with you, and you also have to check in with your family and friends and neighbors to see whether they need help, because not a lot of people will have, and some people might need ambulance services to move family who are unable to move around by themselves. They need assistance. And yes, everyone was encouraged to remain outside of the cordoned area for their own safety until they have been told that the disarming was successful or not.
Preparation was done in hospital. A focus team was established by the Director of Medical Services in Ron Hospital. And the focus team were all included the doctors and the head of units. So the surgeon was appointed to be the team leader for this event. Meetings scheduled for hospital preparations, especially with trainings and information on the disarming of the day. BLS and ACLS training by medical doctors with the support of from the training units, and referral pathway. On the right side, you can see that response plan from the referral pathway. That's where the explosion site, where the bomb was found. And at the explosion site, it's only the ADF, the Australian Defence Team, and the paramedics. With all their resources, that's their own resources. Nothing comes from us to them. So they provide their own resources. And also the transferring of casualties to hospital. We were advised on that day that the expectation for the casualties is only one person. And we were surprised to hear that because, we were looking at massive numbers of casualties, but when we were told only one, then we feel like we more relaxed because that only person is the one is going to disarm that bomb. So that's the only person that we're expecting. But because he's an Australian citizen, Australia won't allow him to come to Ron Hospital. They will evacuate him straight back home to Australia. Yes. They they have their standby ambulance to evacuate him back to Australia. But otherwise, the other casualties, like if locals, they will all come to Ron Hospital. Yeah. So the second one is the triaging. That's our layout of our plan. At the back where the parking area for the hospital will be used for triaging. So we will make sure everything is provided for the tents for the triaging staff and all other equipments that needed. Resource bay, we will have our resource bay here in the emergency. In the next slide, we'll have a layout where I can we can see that the layout for the transferring of casualties to the main hospital. But in resource bay, we have 3 beds, and we provide all those crash cards for each bed, monitors and everything that needed for that resource bay. 4 to 6 staff per bed, and also the if needed the blood products for any severe cases coming in from as a casualty. So from that resource bay to, if stable, then transfer to acute bay. So in acute bay, we also prepare everything, make sure everything is the acute bay is well equipped, and maybe only few staff, 2 staff per bed, and also we have a step down to our outpatient area, just in case there's a spillover from acute bay to the step down in GOPD. And we also prepare the tents at the front of another gates, at the front gate, another tent there, just in case for more cases are coming in, but we have enough space to keep them for a few hours, observe them. OT also, they also stand by for any case that needs for urgent operation. Well, OT is well equipped for all the things that they need for any emergency. So on this slide on the right side, you can see that's the layout of transferring casualties to Ron Hospital. So we have two gates. The main road is on the right side. Yeah. So that's the gate. Currently, we are using that gate for our emergency. So that's our resource bay 1. Yeah, so people will, the casualty will be transferred from where the bomb is, come to the gates on the side. Yeah, that's the resource bay 1. And then stabilize there, move to acute bay. Then from acute bay to step down, GOPD, and then to step down in the tent. So just in case like it's fully occupied from the resource bay 1, we'll be using the resource bay 2, which is there's a different gates for that resource bay 2. And so we also prepare trauma ward and burns ward. For burns ward, we did a very clean up, wipe down on that ward, convert from general ward for the pediatric ward to a burns ward. So we did clean up and we make sure it's fully equipped ready for this any burn case comes in. We do also prepare our morgue and waste disposal for any limbs or anybody that that square. The OT is there just next to the resource bay 1. Yeah. So if anybody that comes in with severe bleeding or that they just come across that resource bay to operating theater. Yeah, so that's where we use at the corner where we place the tents for triaging at the car park. Yeah, that's the one that we'll be using color code to transfer those minor or small cuts or whatever we just triaging them to step down bay or GOPD and other places. Yeah, that's the setup. So other things that we done that the nurses rostered and put in 4 teams, and also information and awareness to the public and staff with regards to roles, to their roles, temporary changes in hospital services, and entry and exit point to the hospital. All doctors and nurses were to be standby on that day.
Yes, I'll just add a little bit. The hospital was advised just to prepare for the worst case scenario. And I guess by the time they made the decision, they felt that even though with their plan and their estimation of just 1 casualty, and they were ready to evacuate the military person who was going to disarm the bomb and the paramedics on standby. But just in case things didn't go well with the disarming and the explosion went off and we missed some people in the community and they were injured or harmed, or those who were on standby at the near for ambulance services for the transferring, if they were injured, then the hospital, we were advised to prepare for the worst case scenario, even though they were planning for a minimal casualty. And I guess it was a good practice for us as well, just in case there was actually a big disaster, and we had to actually go through with this preparation with receiving a mass casualty. So these wards were all converted into what they are shown now. So before they were like the women's wards, the ICU wards, the pediatric wards, the maternity wards. So before the day of the disarming day, the patients who were stable enough, they were all discharged home. So there was a lot of collaboration with public health staffing in order to continue their meds and follow up, and all the communication and the hotlines that were given to the family and patients themselves before they were discharged. There was only about 10 patients left. 10? Less than 10 patients left in the hospital, and they were quite critical. That's why they stayed behind on that day. But everyone else was discharged, and all the wards were converted into this in order to accommodate mass casualties. So as you can see, the main gate area was our main area where we focused our pathways for referral pathways for patients coming in if there was a bomb blast and there was mass casualty. And then this area here on the other side was more of our admissions and our critical cases or any spillovers from the initial influx of casualties that were supposed to come in. And of course, the Australian Defence Force also brought in their team to assist us on the ground and to do an assessment of in terms of what our capabilities were as well as our resources that we had on the ground. So yes.
This is the picture of the one casualty that we are expecting. This is Sergeant Haron Sarmiento, and he's the one working to disarm the, this bomb. So that's the only man that we were advised by the Australian, the medical team from Australia that it's only one casualty we are expecting, but he won't be coming to Ron Hospital. He will just straight back to Australia.
So as you can see, he had these scissors to cut the red wire or blue wire. And I don't know what this is. It looks like a spoon, but anyways, the country of Nauru is very thankful to Sergeant Haron Sarmiento.
Yeah, even the president of Nauru give a big thanks to this guy for helping the people of Nauru, not for the bomb not to explode. Oh. Oh, okay, yeah, that's one. Okay, the reflections. Okay, how did the news of the bomb make you feel? Well, when I first heard this news, when I just speak out from myself, I said, wow, what's going to happen? We never come across this throughout my life. We just saw it on movies and all this. So what's going to happen if it's genuine in, like, you are in that, so it's scary, but we thank God for sending all this help to Nauru to, help us with this sorting out this bomb not to explode where it was found. Otherwise, everything will be chaotic for us. Okay, my role as acting chief matron for planning and preparation. The next roster. I did the nurses roster, and I divided it into four groups. So team 1, team 2, team 3, team 4. So all these teams will make sure that all the supervisor are each in these 4 teams. Also, the midwives should be in each the 4 teams, just in case we come across with pregnant mothers or any women that needs to deliver as soon as possible, but we have them on the ground. So with the teams, team 1 and team 2, the team 1 will be working for 12-hour shift from 8 a.m. to 8 p.m. and team 2 will do 8 p.m. to 8 a.m. for 2 days, while the team 3, team 4, they will take their day off. And after the 2 days, so team 1, team 2 will be off, and the team 3 and team 4 will be working. So that's the plan for the nurses roster. Also, we're scheduling nurses to work and attend mandatory trainings as been planned. Okay. Logistics, working with operations to arrange transportation and meals for the staff, and also assisting with processing, discharging the stable patients with their meds and proper information. As Cherish has mentioned earlier, that most of the patients were discharged, and their relatives, they help them to take them with them home to evacuate, because the hospital is in that red zone. So only few, I think 5 of them, where they refused to go home. They just want to stay in the hospital. Yeah. So, and with reassigning of wards, like burns, as we have mentioned earlier, and also the roll call for pre and post. Before the bomb was disarming, I have to go around the patients and write their names and sign with all their caretakers to make sure they are there. So just in case there's the bomb blast, we have to do another roll call, see that everybody is back, or some people might be missing like that. So the staff and the patients. So yeah. Okay, that's the team graduated from the from the training, from the MIMS. This yeah. Okay, just to continue on with the reflections. When we had the training, what did you find that were similar? The similarities and the difference of what has done and what I have learned. So as well, where there's the bomb is very crucial, that we have seen in the earlier slides. So if as a health professional, also we are just not just handling these casualties, immediate casualties, but also aftermath, such as the disease. If it's really happening, so that will be people of Nauru will be in a very critical condition because of all these important facilities will be all damaged because of the bomb. So, but we thank God for sending all these people to help us, ADF. Yeah. The way for moving forward to happen in Nauru, with some of the similarities and the different with what I have learned from the MIMS, the training. This with the what's this? The triaging, which I learned from the training. It's bit similar, but it's sort of like some of the difference of the way that we communicate. With the communication, those are the different things that I encountered from the training and what I have done from the BOM. Because during the BOM, we don't have the proper way of communication, like we have radios to use it, the walkie-talkies, which is depend on our phones. But we all know that sometimes the phones, the connection doesn't work well, or some people, they don't have the credit, so they can dial out like that. So, to compare the phone and the walkie-talkies, it's the walkie-talkies is more effective than other than the using their phones. And moving forward to what been to see happening in one hospital, we need to form a committee. We do have a COVID committee before, so that committee can just from the COVID, just to move from the COVID to the emergency response team. Yeah, so also we can look into SOPs and the drills. As far as I know, that only few of us, we attend this MIMS training. I'm not talking about the international one, only the MIMS, because some of our nurses are not in that training. So maybe they will have a chance to attend this training. So we can all be in the same page when we doing our drills for for future disaster coming. We never know when, so that's just looking into that, and communication platform and planning for overall general disaster plan for in the future. So, but I'm just requesting on behalf of my other nurses that are not in this MIMS training, because only few of us, we were there. But I think it's always, well, I don't know how but I think it's always best if your team can come for another time to train other RNs, so we can all be in the same page as we go along with this training. Yeah, I think those are the ones that I just want to raise from my side. Maybe Cherish can add on from her side.
Yes, thank you. So my role in training I was just the support for all of these plannings and trainings and all of these things that were happening during the bomb scare days. So it was just by, I don't know, what do you call it? But we were already talking to NCCTRC about the MIMS and HMIMS training. And then the bomb scare happened. And then 2 months after the bomb scare was the time we agreed for NCCTRC to come in on island and help us with training for hospital, major incident, medical management and support. So it was a great coincidence, or I don't know, that we were requesting for this training. And then we had the live scenario happen on island. And then the training came 2 months after that. But the planning for this training was happening way before the bomb happened. So during the bomb scare and all the preparations that we did, we were just kind of doing everything, but at the same time going, are we in a movie or what? Like closing the windows. We saw this in what do you call that movie? Pearl Harbor. They were closing the windows with blankets and everything because the bombs were coming, and then they were advising us all to close the windows with blankets. So we were like, we're not really sure whether this is real, especially for a small island nation that is in the Pacific. But anyways, we'll just keep doing it. But it was a good practice or learning lesson for us as well, because we've never much preparations for a disaster before. Well, not in my lifetime, but we don't get disasters happening in Nauru. The only major disaster that was happening was the COVID. So that's why we were kind of like reacting. But after everyone else in the world has gone through everything, then we get get to experience a little bit of what everyone else went through in the world. So yes, when the HMIMS training came to the island, hospital major incident medical management services, there was a lot of like moments, especially learning about the cordoned area, because all of these terms we read it in the public notice. The cordoned area and the red zone were like, what is the red zone and what is the cordoned area and what is all this talk in this public announcements? And then 2 months later, we learned about the affected areas where the cordoned areas are. So that was like something for me, that was something that I learned during this training. And then the most, I guess, very useful training for us, as well as realization, was how overwhelming it would be for us to be having all these mass casualties coming through to us, and the expectation of us to be always on our feet and being very critical, making critical decisions. Everything should be on the tip of your fingers, and there was so much pressure on us. And having the little scenarios where we lay out the table. Why did I get the name? There was a little table where we planned out the hospital and how would we allocate our resources in terms of the staff that were available and staff who should be on standby, and then the casualties that would come in. That little scenario that we learned, it's like a practical scenario that we learned during the HMIMS training. It was just like, it was a big realization for me that, oh my gosh, we have a lot to do in preparation. And it made me question, like, how are we going to be able to do this with this number of people that we have working here and the resources that we have? How would we be able to make such an, help these people who will be coming in mass numbers when we ourselves were already stressed with the resources that we have. But just going through this whole bomb scare and everything, we were so grateful. And then the training, it's given us some ideas. Like we are sometimes invited to executive meetings where they would talk about how we go forward with making an emergency response team. And the suggestions on the table were just using what we already have. We have the COVID committee. They've gone through the COVID program and all these things. It's just a reviewing it and changing it and making it the general emergency response team and the SOPs and how we will approach it. But everything else is there. The framework is there from when we planned on the surge for the COVID response and everything. So there's a level of response and when should you look for help from our neighboring countries and all of those. They're all there in our surge guideline, but just using what we have and actually working on this for our own hospital emergency response planning. So also during this training and also during the bomb event and all those that were happening, it was also the first time for me to be working in collaboration with the National Emergency Response Team. Whereas before it was the task force that was working with the emergency response services and the police and everything like that. And now that everything has been stood down from COVID, now the responsibility of having an emergency response team has also come down to our level as training managers and those who are working in the hospital. So it was also the first time for us to collaborate with the National Emergency Response Team and be in this training together. And I was so grateful that they came in the training as well with us, because we've kind of established that networking with them as well. And now we're talking nonstop about fire drills and working on fire safety presentations, especially with that training, because some trainings we've established that we need to include fire safety and fire drills as part of our annual mandatory trainings. But before, there wasn't a lot of, we were not syncing, not communicating well with the emergency services. But this week, we've been able to carry out those trainings because we have that established relationship now. We know who we are, we know who's responsible for what. We have our own phone numbers and emails. We're constantly in communication. Whereas before, there was a lot of processes in terms of how we should be able to communicate from training directly to the National Emergency Services team. We have to go through the proper channels. Now it's like, even though we're a small country, these processes that happen and procedures that we have to follow is sometimes a hindrance to us as well, especially when everything is, we have to do everything within our time frame. So yes, it was, and I have to inform Vi that after the HMIMS and MIMS training, there is the opportunity for the Train the Trainer program that we were talking with Gav about, where they have already picked potential participants to be trained the trainers for the MIMS. So those people, they will be trained and then they have the opportunity to go back to their departments and train the people in their departments on those MIMS and HMIMS that we did. So we're still in communication about
okay.
that.
Yep.
Just like Bryce said. But yes, overall, it was a very good experience, even though it was a scary experience. But just having all this, I don't know, everything aligning with the talk about the HMIMS training we were requesting from NCCCRC, and then having that bomb scare happen, and then the training actually came, and the same people who were active during the COVID response, they were practically the same people that we all had invited to be part of this proper training, because some of them were active because of the roles that they do in the hospital. So they were not part of the executive COVID committee team that were doing a lot of planning, but because they were very active during the COVID response. So those were the people that we chose to be part of the HMIMS training, the Hospital and Major Incident Medical Management Support training. So a lot of them, they were getting like light bulbs. Oh, that's what that's what they did. That's what we did, and so that's what we need to do next. So yes, so Vi was chief matron during that time, and so she's very hands-on during that COVID and then the bomb scare, and now she was also one of the participants that we wanted to go through this proper training with HMIMS, and we know that she will be in that emergency response committee as well. Yes, I think that's it from us. Thank you very much. And yes, any questions, we'll try our best to answer. And also feel free to give us some pointers.
Wow, thank you so much, Vi, and thank you so much, Cherish. I think I'll probably speak on everyone's behalf in thanking you for a really interesting discussion. I've got a couple of questions for later on, but before I ask any questions, can I ask if there's anyone else that has any questions, comments, or suggestions, please? Oh, we've got one from Mark. Mark is asking, were you supplied additional resources such as blood products and burns dressing for the period of disarming?
No answer.
We are not being supplied. We have our own products for, for blood products from our lab. But with the burns, we are not being supplied from anywhere. We just have our own, whatever we have, the resources there, we just use it for our burns. But the good thing is that nothing was happened. But if one or two, then it will be a different story for that, because we will need more proper resources for the burns case. Yeah.
Also, I guess because we were advised to supply and prepare for this. So whatever we had on hand, those were the ones we had to take inventory and prepare. And the different units were in charge of getting the lab. They were assigned with the blood products and burn dressing and everything. The thing with us on Nauru is that we have good supplies of these things, but it's just the people that we don't really have enough of. We have good resources coming in weekly. We have access to everything. And also the Australian Defence Force, when they came on island, they also brought their equipments and resources, but they were just letting us know that if we needed more, those they have assigned to work with us, they came and did an assessment and everything, and they were saying, okay, you have good supplies for now, but we are willing to support also in that area if so there was a need, because the plane comes in twice a week and we don't have issues with bringing in supplies if there was needed. And also the Air Force, the Australian Defence Force was also on standby to supply us what they have. And yes, so our CSSD was working overnight to produce all these things, and the lab, and people were all working overtime to provide all of this for the day of disarming. And yes, I hope that question, we answered that question for Mark. But I see also iPhone 3 has asked a question. Was adequate staffing difficult to achieve? Yes, adequate staffing was difficult to achieve, especially based on the SOP that they gave us, where they said that on each bed, there should be 4 to 5 staff on standby at each bed in resus 1. And then just imagine all the other wards that they have to be in those areas on standby as well. So it was difficult to achieve. But what we did was, as Sister Vi said, we had to put them on 12-hour shifts so that they will be able to increase the numbers of people working in that shift. And also we had to allocate the different capabilities of the nurses around. For example, like the ICU nurses, we had to put one senior nurse in the ICU resus bay, and then one in the different areas where we would expect to be handling more critical cases in. And then the more general nurses, for example, we had to like reassign some of the nurses who were working in the outpatient services because we closed them down. So the services that we've closed down, we've reassigned those nurses into the areas where we had to make them put them on standby. For example, the dialysis, the public health nurses, the dialysis nurses, the public health nurses, the clinic nurses, the family planning nurses, all the nurses who were working outside of the hospital were all reassigned and put on buffer rosters, and anyone who was on leave, they were all called back to be on standby, and they were advised that they'd be put on a buffer roster and to be on standby. So that's how we were able to kind of accommodate for that need by reassigning staff, closing services, and just putting everyone's effort into that one area to be able to meet the minimum requirements that were given us. For example, the resus bays and the ICUs and vents areas and all of those. So that was one way we were trying to mitigate those and meet the needs that we were asked to do. I hope that question, I hope that answers the question for iPhone 3. Yes.
We've also got from Dulcie, she said it's not a question as such, but she would just like to say how amazed she is at the organising and effort you put in. This is new for us, and you did very well. Thank you for sharing your experience with us.
Thank you.
Thank you, Darcy.
And we've got another question from Mark. Mark's asking, may I ask the normal capacity of the hospital, and was there a plan for evacuation should your capacity be overrun? So I think he's asking if there was a mass casualty incident and the hospital became overwhelmed, have you got an emergency response plan to cope with that?
Yes. So during the COVID preparations, there was this whole thing that we did where we engaged the community to take on responsibilities such as with swabbing and all these things. And there was also like they created a section where they hired temporary staff as health support staff to help out with the surge and need of all of this. So with that, during the preparation for this bomb threats, the NES and all those other services, they were tasked to create little pop-up areas where they would upskill volunteers to do first aid trainings and all of these things. And we also reassigned some of our students to take up to go back to work and put them, and even students who were on holiday, they were on break, the July holidays, like they were also putting their hands up to be helping out. And so we really had to look into the community in terms of who the volunteers of who would be willing to help us. And the Australian Defence Force team was working closely with the National Emergency Services team in order to also provide backup as well, even for our services that we will, if there was a scenario where we would be overrun. So they were creating the pop-up tents around the island. Like one was at our parking area, where they set up the military relief area in case the hospital was overrun. So the Australian Defence Force set that up, as well as the public health. Like the public health was very much involved with engaging the community and the National Emergency Response Team to take up, do first aid trainings with the community. And yes, so I think that was one of the things that we did in terms of preparing for a surge or when our capacity was overrun. I hope that answers your question. Thank you.
Thanks both. I think we've probably got time for one more quick question, if anyone's got one. No? All right. Well, on that note, I think thank you both ever so much. And I think like what you said, the running theme throughout the whole of your presentation, you know, yes, Nauru might be a very, very small island, and you might be extremely stretched for resources, but under the extraordinary circumstances that you were exposed to for those 2 weeks when the bomb was discovered, and then sort of having the training afterwards, really does exemplify what you are absolutely capable of doing and putting into practice. The disaster response plan that you put up was great to see that you have that. And can I just ask, is that something that you have now, is that accessible going forward into the future for everyone? Or is it all up here?
No. One car, Chuni Wami Kayak, Tony disaster plan draft or something like that.
Cool, no?
Cool. Actually, yes, Vi has said, confirmed that it is right now, it is all up here right now. And it is discussed in the meetings, but we are yet to put that into full gear.
Yeah.
Yes.
And that's fine. Small steps.
Yes,
You're making really good progress. So thank you both very, very much. And thank you to everyone for joining us this month. And hopefully we'll see you in December. The details of which will be released soon. All right. So hopefully enjoy the rest of your day all, and we'll see you all soon. Thank you.
Thank you very much, everyone. Have a good afternoon or good morning. Thank you.